Good evening, everybody. I'm Sayukta from beautiful Spotless Skin team. I'm sure all of you must be keeping good health. To look beautiful and smart at all times is quest of humans right from the beginning of civilization. Few of the common conditions affecting the look and feel of a person is acne, hyper or hyperpigmentation, and even hair loss. Out of these, acne is a big concern, especially for women in their 20s. However, it would be wrong to say that men don't suffer from acne. To many, acne is also known as blemishes, blackheads, whiteheads, pimples, or cysts. It is most common during puberty and adolescence. According to a recent data, almost 80% of people in the age group of 11 to 30 years have acne outbreak at least once. Although acne most commonly does not have any serious health concern, but is de-stressing for the sufferer. The faster the issue is diagnosed, more effective will be its treatment. Thus, knowing about acne management from an expert is essential. For this, today we have Dr. Asma Akhlaq, a consultant dermatologist from Jaipur, live with us to educate us more on acne management. Dr. Asma is a consultant dermatologist at CK Birla Hospital, Jaipur. Dr. Asma has done her MD in clinical dermatology from Boston Medical Center, USA. She was a gold medalist during her MBBS times. Her expertise is in skin cancer, pigmentation, acne, etc. Dr. Asma was a consultant dermatologist at MD Skin Science, New York for more than 4 years. We are sure with her expertise in clinical dermatology and acne, Dr. Asma will enlighten us more on acne and its management. A very warm welcome to you, Dr. Asma. Hope you're doing good, ma'am.
Thank you so much for having me. Thank you.
It's a pleasure to have you with us for this session. And as today we are going to talk about the management of acne, we would like to, first of all, understand what causes acne, doctor.
That's a really, really important question. Everybody keeps asking, why do we get acne? Nobody questions ever, what is acne? So
Right.
acne, actually skin के अंदर glands होते हैं. We have sebaceous glands and we have hair follicles. So what really happens during teenage time, or let's say during like 13 to 16 years mostly, sebum production जो होता है वो hormonal level के साथ fluctuate करता है. So the androgen levels at the time of puberty generally increase, and that gives rise to sebum production in the skin. Sebum हम normal language में उसे oil बोलते हैं. ऑयल जो होता है वो पाइलोसेबेशियस ग्लैंड्स को ब्लॉक कर देता है और उसके अंदर थोड़ा सा बैक्टीरियल इन्फेक्शन होने लग जाता है प्रोपेनियोबैक्टीरियम एक्नेस का, और दैट गिव्स राइज टू एक्ने. And now that we have acne, the acne is further classified. जब early होता है तो वो early comedon type का होता है, जैसे black head, white heads जब हम देखते हैं, फिर वो और थोड़ा progress करता है. That's when we get the inflammatory, the red looking, angry looking acne, and then further एकदम nodular, cystic type के acne हो जाते हैं.
Right. So this is basically what acne is, and how many forms of acne are there. And again, doctor, as we were talking, why we get acne. I mean, what are the basic causes? You said age is one thing because, of course, hormonal, change do happens at certain age. But then, apart from that, what are the other causes?
So acne actually can be because of numerous reasons. Acne could be because of some medicines you've taken. Some people who've never acne in their teenage come to us and tell us कि वो हमारे तो कभी नहीं हुए acne, अब हो रहे हैं. फिर उनसे जब आप डिटेल हिस्ट्री लो तो पता चलता है कि they have been taking corticosteroids, or they've been taking lithium, or they've been taking some anxiety medicines, something like that. So it's very important to take a detailed history. Nowadays, post COVID, we are seeing a lot of patients with acne around this area. Like we call it maskne, which is like acne due to the mask use. People get it like contact acne. For example, people who have guitar all day long in a cross body, so they get it on the shoulders because of friction. Some people tend to have it on the back, on the front, on the chest. So acne could be due to numerous reasons. So number one, there has to be a detailed history about acne, like when did it start, how did it start, is it painful? Sometimes when it's painful, it's not even acne. People call it acne, but sometimes it's folliculitis, which is another ball game. It could be like n number of things. People call every single bump on their face acne.
the list of causes can just go on and on. तो
Yes.
causes तो बहुत सारे हो सकते हैं, लेकिन हम ये भी जानना चाहेंगे डॉक्टर, कई बार लोग शिकायत करते हैं कि अलग अलग सीजन्स में उनको कई बार एक्ने का सामना करना पड़ता है. तो does acne is specific to any season or occurs throughout in year? Because many times during heat also, during summers also, heat can also cause acne breakout is what people normally think. So please हमें बताइए इसके बारे में.
Sure. Thank you. So acne can actually generally happen throughout any season, throughout the year, but some people, especially women, tend to see it more during their premenstrual cycles. तो जो अपने menstrual cycles होते हैं, monthly cycles होते हैं, उससे करीब एक हफ्ता पहले लोगों को breakout ज़्यादा देखने को मिलते हैं. Like I said, sometimes heat, stress is a very big cause. Stress can really exaggerate acne, spicy food, dairy items. Sometimes when it's wedding season, marriage season, so people tend to break out a lot. That's because of the food they are eating. Sometimes that also worsens acne. But acne can happen in any season. There is no particular season promoting acne. And people who tend to have a genetic history of acne, like say your family had acne, like your mother had acne, in her days, now you're already predisposed, you're genetically predisposed also to have acne.
Fair enough. Now, doctor, as during the introduction part, I was telling that there is a data which says that 80% of people, and during their teens or early adulthood, do experience acne. Acne बहुत common है, ये कहा जा सकता है. एक तरह से हम ये भी कह सकते हैं कि अमूमन सभी को acne होता है कभी ना कभी. Now, is there any way we can prevent acne breakouts?
So this is a very very important question. Acne breakout prevention के लिए करना क्या चाहिए? So acne can happen at any age. Usually we used to see more people in their 20s or like teens breaking out, but nowadays you wouldn't believe, like I see 30% of patients having acne in the age group of 40 to 50. So I feel like the age is shifting. And that may be because of people are taking, hormonal pills to avoid pregnancies. It could be because of IUDs, oral contraceptive pills. The age of menopause is also changing. The stress levels are very different. Exposure to sunlight, food. There's so many factors exaggerating. In order to prevent acne, number one, I feel when you are in that age of breaking out, of let's say when your family is predisposed already for acne, you should start using something with like salicylic acid or glycolic acid, something with some kind of like chemical peeling acid in there, that would help instead of like going for parlor treatments. I know people go for scrubs, and all these things can further exaggerate acne. I believe that one should use like a good cleanser. Number one would be an exfoliating cleanser with salicylic acid or glycolic acid. Number two, I feel people should also sanitize their phones. These days phones are everywhere. People take it to the washroom, people take it to every place you can imagine on earth. Yeah. And they don't realize that it could be the breeding ground for like insects, or it could be breeding grounds for like microbes and all of that, which would really exaggerate acne. So number two, you need to really sanitize your phone every now and then, depending on how you're using it. Number three, I feel like pillowcases are also highly neglected. I mean, you actually sleep on the pillowcase, so your face technically just touches the pillowcase. So definitely pillowcase change should be done every other day, if not like daily. Then what else can you do? You have to reduce down dairy products like food. I know everybody talks about food and the relationship with acne. I keep getting this question all day long, that what kind of food should we eat? Should we eat oily food, not eat? Kaisi diet lein, vitamin C lein, aloo khaएं, chawal khaएं? So I always tell my patients, eat whatever you can and eat whatever you have to. The only thing you have to watch, which is again controversial, food linkage with acne is highly highly controversial. So sorry about that. So food linkage with acne is highly, highly controversial. So only two things have been linked with acne. Number one is milk intake, and number two is food with high glycemic index. So the foods that give like instant energy, let's say it could be a glucose drink, or it could be a pasta, or it could be like morning cereals. All these things are like controversial, and just like milk, dairy in general, dairy and dairy products. Else you can eat everything.
Okay. सो बेसिकली कुछ साल पहले rather एक सर्वे आया था जिसमें कहा गया था कि आपकी टॉयलेट सीट से ज्यादा गंदे आपकी उंगलियां होती हैं, हाथ होती हैं, तो कई बार एक्ने के लिए हमेशा कहा ही जाता है कि कीप योर हैंड्स और योर फिंगर्स अवे फ्रॉम योर फेस, बिकॉज आप जब
Yes,
जितना
yes.
आपके हाथ क्योंकि साफ नहीं है, आप बार बार साफ नहीं करते हो, तो आप जितना टच करोगे अगेन इट विल मेक इट वर्स। अब जैसा कि आपने कहा कि फोन जो है वो मुझे लगता है टॉयलेट सीट एंड हाथों से भी ज्यादा गंदे होते हैं, बिकॉज वी टेक आवर फोन एवरीवेयर एंड एनीवेयर एंड विल कीप इट
Right.
in any condition, and of course so it's important to sanitize the mobile phones as well. तो हाइजीन एक बहुत बड़ा फैक्टर है। डाइटरी प्रिकॉशन में आपने बोला ही है कि जो डेयरी प्रोडक्ट्स है उनको हम थोड़ा रेस्ट्रिक्ट कर सकते हैं। अगेन मेनी थिंग्स in the dietary section that are controversial. We'll talk about it later. But again, as you also said, doctor, many times, nowadays the cases are increasing where people who are not in their teens anymore are coming and complaining of acne
Acne.
breakouts. Now, does acne occurs in old age as well? So yes, definitely. You said that people are coming in their 40s or 50s and complaining about acne. What again? You also told us about that. Stress levels are high, things are changing. But और क्या-क्या वजह हो सकती है? And it's actually very annoying कि teens में नहीं हुआ या हुआ भी है तो बहुत मुश्किल से वो ठीक हुआ और फिर acne breakouts हो रहे हैं। मास्क लगाने के बाद तो acne breakouts बहुत ज्यादा, especially humid and hot conditions में बहुत ज्यादा acne breakouts होते हैं। What to do? What should we do?
Also, like a lot of exposure to these chemicals these days, you know how sanitizing sprays and all of that, all these chemicals can also give rise to acne. फिर hormonal component होता है acne का, तो acne जैसे जिन लोगों को polycystic ovarian disease है या कोई भी menstrual irregularity है, let's say जिसमें FSH हार्मोन, LH हार्मोन, अपना टेस्टोस्टेरोन लेवल जिनके भी deranged हैं, that can also give rise to acne. That acne mostly happens in the lower one third of the face. So usually in the people who are in their 30s or 40s tend to break out more in the lower half of the face. Also जब वो break out करते हैं तो उनकी थोड़े से hair growth चालू हो जाती है, sometimes in the beard area, and they're very concerned. Sometimes it's amusing because patients come to me for that hair एंड नॉट दी एक्ने, मतलब एक्ने भी हो रहा होता है बट उनका पॉइंट ऑफ कंसर्न ये होता है हमारे आदमियों जैसे बाल उग रहे हैं बियर्ड एरिया में, एंड देन यू लुक क्लोजली एंड यू लाइक ओ बट यू हैव एक्ने आल्सो, एंड देन दे टेल यू ओ हाँ एक्ने भी है। फिर आप जब उनसे पूछते हो तो पता चलता है कि मेंस्ट्रुअल इरेगुलरिटीज भी हैं. So then it becomes important. Sometimes treatment, we ask them to go to an endocrinologist first, treat the cystic part of the ovary disease first, or depending, sometimes we treat it if it's mild enough. That's how it goes.
Right. And even if we, keep on saying that girls or women do, experience acne more, but then it would be wrong to say that men don't have acne. They also encounter, acne breakouts. They also go through the phase. Now, how about them? Because hormonal changes बहुत ज्यादा नहीं होते या दूसरे तरह के problems नहीं होते, तो men में जब acne breakouts होते हैं, what should they do?
सो मैन एंड विमेन इन टर्म्स ऑफ फिजियोलॉजी तो ये एक्ने की तो फिजियोलॉजी काफ़ी सिमिलर ही है. मतलब एंड्रोजन स्टिमुलेशन होता है, एंड्रोजन इज अ हार्मोन विच इज प्रेजेंट, और उसकी वजह से सीबम प्रोडक्शन स्टार्ट हो जाता है. अगेन इनिशियली इट्स अ कॉमेडॉन विच इज जस्ट लाइक अ ब्लैक हेड, वाइट हेड. ब्लैक हेड जैसे अपन देखते हैं, it's not black because of dirty or like hygiene. It's black because of like oxidized melanin, epidermis. There's a lot going on in there also. मेन के अंदर एक्चुअली एक्ने आई फील मेन के अंदर ज्यादा होते हैं, बट मेन टेंड टू निग्लेक्ट इट एंड नॉट ट्रीट इट. यू विल सी अ लॉट ऑफ मेन विद लाइक ग्रेव एक्ने स्कार्स ऑन देयर बियर्ड एरिया स्पेशली, बट वो डॉक्टर को नहीं दिखाते. समटाइम्स इनफैक्ट टीनेज मेन के अंदर एक्ने, वी कॉल इट एक्ने फल्मिनेंस, where the acne is so much that people tend to have pain in their this bone, like we call it clavicle, the shoulder bone. People tend to get a lot of pain in their clavicle because the acne is so big and it's all like on the chest, on the back. But the treatment part is also very similar, except that women can be given oral contraceptive pills and men cannot be given that. The treatment is pretty much the same, be it a man or a woman.
Yeah, we would like to, know a little more about the treatment options available. So please shed some more light on that, doctor.
Sure. So again, a treatment, when we talk about treatment, first we have to find out what is the cause of acne. Like, is it just like normal acne happening because of hormonal disease, or is it be specific because of hormones, or because of something they're taking, something they're doing, something they're applying to your skin? Sometimes you might be applying some product which is just clogging your pores momentarily, or you might just go to a parlor and you just had a scrub or a spa or like some facial with some funny facial. You know how these parlors are coming up with like weird things these days, and you might just be breaking out because of that. तो अगर ऐसा कुछ है, then you just eliminate the cause and give like normal treatment. But agar or there's further can, like if there's mild acne, moderate acne versus severe acne. So if there's a mild acne, then what I do generally is the topical stuff. I don't give them pills to eat. I give them, number one, an exfoliating nice cleanser having salicylic acid and glycolic acid, and I tell them that this will dry out their skin, because a lot of people will not take it if you don't tell them that. They will apply it once, they'll come back, they'll say कि oh ये तो हमें dry कर रहा था, irritate कर रहा था. तो इट्स वेरी इंपॉर्टेंट कि आप पेशेंट को पहले ही बता दो कि देखो ये है, इसको इतनी क्वांटिटी में लगाना है, फेस के ऊपर लगा के 30 सेकेंड्स के करीब रखना है, एंड देन जस्ट वॉश इट ऑफ. और थोड़ा सा स्किन ड्राई होएगा इसके बाद. Then always, it is always to be followed by a moisturizer. I always say, if you don't use a moisturizer, you will break out. Like, using a moisturizer is very important, and using a good moisturizer. And number three would be a sunscreen, because acne हमेशा sunscreen के साथ ही जाता है. मतलब acne हो जाएगा, अब acne का तो treatment आपने कर दिया, but वो पीछे एक dark mark छोड़ जाता है. And then people are concerned about acne scars. So whenever you give acne treatment, you have to ask the patient to either use a sunscreen of his own, if it is good enough. If not, then you have to prescribe it. Then I like giving retinols, which is like tretinoin, adapalene. बहुत सारे आते हैं market के अंदर. It's going to be a nighttime cream. You just take a small little amount, like मटर के दाने जितना लेकर. Literally, you have to apply on your full face, and it's a magic drug, I feel, because it can not only fight acne, it fights fine lines, it fights pigmentation. So it's a beautiful drug. You use it all over your face. This is what I would suggest to do for, like, let's say mild acne. Now,
Right.
if the acne is, let's say, moderate, like some people, moderate would be like, red, angry looking spots, like big bumps, plus like these tiny little small blackheads, whiteheads all over the face. In that case, I generally give an antibiotic for some time. The antibiotic could be like doxycycline, azithromycin. There are a couple of others which we consider, depending on a lot of things, depending on patient's age, his occupation, other medicines he's already been taking, or like other diseases which he has. Because you have to make sure, some people have like gastric upset, or they don't want any medicine to like really hurt their stomach, then I tend to not give doxycycline. Some people have their deranged LFTs, then you have to give a different type of medicine. So you really have to take into account all of those things before prescribing. And then comes like severe acne. So in severe acne, again, there are a couple of things which you do. So severe acne is when you have a nodule, or when you have a cyst, like a big cyst, like, it literally looks like a funcy on the face, like a lot of funcies. Some people tend to have that. Then I give isotretinoin, which is Accutane. It is again a retinoid kind of a pill, but it is a beautiful drug. That's like the Ramban for acne. So you start it on 10 milligrams, 20 milligrams, and you give it to the patient. The only thing which you have to make sure is that you can't conceive on that medicine. So if you're a woman, before giving that drug, I have to make sure, that no pregnancy is happening in the next 3 to 6 months, and then I start that medication. Also, there are a lot of antibiotic gels available in the market, like there's clindamycin, there's niacinamide. All these go hand in hand in conjunction with the acne treatment. And then, of course, there is old contraceptive pills for women, which also help to reduce the breakdown in women, that can only be given in women. And then we have chemical peels, we have in-person treatment also, in clinic treatment also, where we use the laser to kill the acne-producing bacteria, or we use chemical peels to, in general, to like just get rid of the increased cohesiveness of the epidermis, or increase the acne-causing skin.
Right. You also emphasized on the use of the right kind of moisturizer and right kind of sunscreen for especially acne prone skin. Now, the thing is that especially those who have acne prone skin or who have oily skin, they normally, in general, like to avoid moisturizer and sunscreen, complaining that, moisturizer will make my skin more oily, or
Right.
sunscreen makes me sweat a lot, or I experience a lot of acne after using sunscreen, etc., etc. Now, first of all, we would like to talk about moisturizer. What kind of moisturizer, and what is the right way of using or applying a moisturizer, especially for an acne prone skin?
Right. In acne prone skin, number one, you need to make sure that the moisturizer is light. By light, I say it's not like too greasy. You don't want to apply like literally Vaseline or anything which can clog the pores. This is another important thing. If the patient is using, let's say, some products of, this is what I do when I see any patient of acne. I tell him to get all the products which he's using currently. So literally, some people get like big bags and they have like products from like n number of websites. They're looking at bloggers and they're just like ordering stuff, and sometimes those products are the culprit. Sometimes people are just using the products for the benefit and they don't realize that it can actually clog the pores and just worsen, or maybe just the cause for acne. So coming back to your question, moisturizer needs to be lightweight. If the moisturizer has inbuilt sunscreen, nothing better than that, because that really improves the compliance. Like if I tell patients to use like 5 different creams at 5 different times of the day, versus if I can just reduce it down to 3 times, patient will be happier, and patient will come back to me sooner. So that's so my style is I generally do a moisturizer with sunscreen, but always the packaging, read the packaging very very clearly, very very near, like you have to really like read every single thing. Like these days the packaging plays a lot with English words. Like I was just looking at something which just said unscented versus fragrance free. This is just an example I'm saying. For me, for a layman, it might mean the same, like unscented versus fragrance free. But fragrance free means that there's no fragrance added to the product, whereas unscented means that there is something added to overcome the scent of it.
Oh,
So how they are playing with English these days, so you really have to be very particular about what you're using on the skin. So when you buy a moisturizer, always make sure the packaging says non-comedogenic or it says oil free. If the product is not, if it's not mentioned, and if the shopkeeper is just telling you, oh, it will like it's oil free and it is not, don't believe anyone, because research, science, unless it's proven, they cannot put it on the packaging. And once it's written on the packaging, that has to be true, at least. um, so yeah, anything light on the skin, I generally prefer something like which is fragrance free, because the more fragrances, the more chemicals you apply, should be used. Number one, again, on the packaging you need to check if it's oil free or non comedogenic. Meaning non comedogenic मतलब ये होता है कि आपके स्किन के पोर्स को वो क्लॉग नहीं करेगा। ठीक है, तो एक चीज़ तो हमने ये मेक श्योर कर ली। दूसरी चीज़ हमें ये देखनी है कि वो ब्रॉड स्पेक्ट्रम हो, मतलब यूवी लाइट, जो अल्ट्रावायलेट लाइट जो सन से आती है, वो बेसिकली यूवी ए और यूवी बी होती है। तो ब्रॉड स्पेक्ट्रम का मतलब ये होता है कि वो यूवी ए और यूवी बी दोनों को ब्लॉक करेगी, क्योंकि दोनों को ब्लॉक करना ज़रूरी है। अपन हम ये कई बार सोचते हैं कि गाड़ी के अंदर जा रहे हैं, क्या करेंगे सनस्क्रीन लगा के, सो यू विल बी सरप्राइज द यूवी रेज कैन एक्चुअली पास थ्रू द ग्लास एंड इट कैन अफेक्ट यू।
mhm.
Also, if you're in your house these days, these fancy lights, they also have some amount of UV percentage in there. तो घर
Okay.
पर भी अगर हम हैं तो हमें UV लगाना ज़रूरी है।
Mhm.
Number three, what I look at always is going to be the SPF number. SPF always stands for sun protection factor.
Right.
Which also answers one of the questions here in the chat.
Yes.
They say high number SPF better than a low number one. It's very controversial. So what the
Mhm.
research says is anything more than anything more than SPF 30 is good for your skin. More the better, they say. But I've practiced like 10 years of my practice in US. People used to get skin cancers because of sunlight. All we used to tell them is SPF 30 is good. Bigger numbers are just marketing gimmick. Like these days, I was looking at one of the websites and it was giving SPF 96, and I was like surprised to the core. So
Oh.
SPF 30 is what the more important part is how to apply it. How you
Mhm.
paint a wall, जैसे हम दीवार paint करते हैं, लिटरली अगर कोई भी स्पॉट रह जाता है, दैट इज व्हाट रियली अफेक्ट्स इट. तो 2 चम्मच, जैसे 2 tablespoon ऑफ सनस्क्रीन इज द अमाउंट ऑफ सनस्क्रीन यू नीड टू अप्लाई. You need to check if it's water resistant or not. Usually water resistant prefer karo, because especially weather like is such in India that it can really get hot, it can really get sweaty, or sometimes it can just rain, without even prior intimation. एंड देन ये अपन ने सनस्क्रीन लगा ली फेस के ऊपर, पूरा अच्छे से सनस्क्रीन लगा ली. सनस्क्रीन लगाने का सही तरीका ये है दैट यू नीड टू री अप्लाई इट आफ्टर एवरी 2 hours. इफ यू आर स्टिल आउट इन द सन, देन यू अप्लाई इट आफ्टर एवरी 2 hours. आई नो आई टेल दिस टू एवरी पेशेंट, बट आई नो इसमें भी कंप्लायंस कमी रहती है. सो आई टेल देम टू अवॉइड सन. 10 से 4 बजे बाहर ही मत जाओ. फिर भी अगर बाहर जा रहे हो तो लगाओ. फिर जब अगर वापस आ रहे हो तो वापस लगाओ. ऑन क्लाउडी डेज लगाओ. सम पीपल आर लाइक, ओ आज तो बारिश आ रही है, आज तो धूप ही नहीं है. सनस्क्रीन डजंट प्रिवेंट, लाइक सनस्क्रीन इज फॉर सन. सन है, हमें आसमान दिख रहा है, दैट मीन सन है. उजाला है, दैट मीन सन है. चाहे क्लाउड आ रहे हैं, चाहे रेन आ रहा है, नो मैटर व्हाट, सनस्क्रीन इज अ बिग बिग मस्ट. एंड देन अगेन सनस्क्रीन पैकेजिंग बहुत ध्यान से पढ़ो. सनस्क्रीन में क्या डला हुआ है, क्या नहीं डला हुआ. सम पीपल आर एडिंग व्हाट नॉट, लाइक दे ऐड एलोवेरा, दे ऐड व्हाट नॉट जेल टू इट. You don't need a sunscreen like that. You need something light. There are a lot of options which are specifically recommended for oily skin in conjunction with your treatment. आपको आपके dermatologist को visit करोगे, वो आपके लिए personalized, customized list बनाएगा product which well suits your skin depending on your hobbies. Some people go swimming, some people let's say go gymming. So everything requires a different type of sunscreen and a different
Right.
type of medicines as well.
Right. So choosing the right kind of sunscreen as per your skin type and as per your work schedule, or in which condition you work, etc., is what you need. And in case you're confused or have doubts, please go and consult your dermatologist, because they'll help you out in this. Now, another thing with acne or acne-prone skin people are that they'll actually land it to the doctor really late. They'll first, whenever they have an acne breakout, they'll go inside their kitchen or to their kitchen garden and try to fix it from there. Dadi nani ke nuske is what we love to go on our face.
Yeah.
या फिर many a times, अच्छा उसने ऐसा किया था तो उसने ऐसा किया था तो मैं भी ऐसा कर लेता हूँ. So, how about these home remedies, and asking or following a friend or a family, or even following an influencer can be in case of acne?
देखो, द मोस्ट इम्पॉर्टेंट थिंग इज दैट वन मेडिसिन फिट्स ऑल कॉन्सेप्ट नहीं होता मेडिकल साइंस में. हर इंसान अलग होता है, हर इंसान की एक्ने अलग होती है, ग्रेडिंग अलग होती है. बहुत सारे लोग, इनफैक्ट मेरे पास तो एक पेशेंट आया था, वो टूथपेस्ट लाइक हिज एक्ने वाज वाइट इन कलर. आई एक्चुअली डिडंट नो व्हाट इट वाज, तो मैंने एक अल्कोहल स्वैब लिया, स्टार्टेड टचिंग इट बिकॉज आई वाज लाइक व्हाट इज दिस. एंड देन आई सी एंड आई वाज लाइक ये क्या है. तो वो बोलता है कि टूथपेस्ट लगा लिया था, बिकॉज उसकी जो बड़ी बहन है वो भी टूथपेस्ट लगा लेती है, एंड कोलगेट वर्क्स एंड क्लोजअप डजंट वर्क. एंड ही started telling me all that, and I was like, wow, you need to stop, man. And then I had to explain that toothpaste has like no role. I was looking it up on the web the other day. They said aspirin घिस के लगा लो, paracetamol की गोली को तोड़ के लगा लो. I'm sure people are following it blindly. I had a patient who had a burn on the face the other day because वो विटामिन सी लगाने की कोशिश कर रहा था. उसने सोचा कि विटामिन सी तो लेमन में होता है, तो उसने लेमन फेस पे लगा लिया. अब उसने ये नहीं देखा कि विटामिन सी जो होता है वो होता है एस्कॉर्बिक एसिड. विटामिन सी ये आई मीन सॉरी ये लेमन्स में होता है विटामिन सी के फॉर्म में एस्कॉर्बिक एसिड. उसने वो लगा लिया और वो पूरा फेस ही जल गया उसका एज अ रिजल्ट. So people do weird things. Sometimes it can really make it worse. The other practice is people go to parlors, and the parlors would do some chemical treatment, or they'll extract some of them. I don't know what all people are doing. और उससे वो सब और इन्फ्लेमेशन बढ़ जाती है, स्किन के अंदर रेडनेस बढ़ जाती है, इन्फ्लेमेशन बढ़ जाती है, और एक्ने कॉज हो जाते हैं. बहुत सारे लोग डी टैन वी टैन, आई डोंट नो व्हाट ऑल केमिकल्स पीपल आर अप्लाइंग, बट आई रियली वांट टू टेल देम कि अगर आपकी कोई एक्ने का स्पॉट आया है लेट्स से, और शाम को आपका कोई इवेंट है या कुछ भी है, डोंट रन हियर एंड देयर, डोंट रन टू अ पार्लर, गो टू लाइक अ बोर्ड सर्टिफाइड डर्मेटोलॉजिस्ट, गो टू अ गुड वन. हम लोग स्टेरॉइड्स डायरेक्टली उस बम्प में इंजेक्ट कर देते हैं एट दैट मोमेंट, एंड विद इन द नेक्स्ट 2 hours that bump will be gone. So there are a lot of things which we do in clinic also which works, and which are very safe, which are in, you do it in very very safe hands. Instead ये घर के नुस्खे, किचन में जाके खाने की चीजें प्लीज खाइए, लगाने की चीजें प्लीज लगाइए, दोनों को मिक्स और इंटरचेंज बिल्कुल भी मत कीजिए. लाइक नींबू इज वेरी गुड इन टेस्ट बट वेरी बैड फॉर स्किन. टूथपेस्ट इज वेरी गुड फॉर योर टीथ but not good for your skin. It has not been researched enough. मतलब उसको मत लगाइए, सब वर्सन हो जाता है. अगर एक्ने के आसपास रैश हो जाता है, then it becomes very difficult to treat it. And some people also have this habit where they go to a pharmacy, chemist के पास चले गए, वो बोलेंगे क्या जाएंगे डॉक्टर के पास, स्किन का डॉक्टर के पास क्या करेंगे, वो गए फार्मेसी, कोई भी केमिस्ट, they got some nonsense cream and they've been applying it. और अप्लाई करते ही वो एकदम मोमेंटरीली चला जाता है, and they feel very happy, and then they're using it for like years to come. And then like after 2-3 years of regular use, then they come to you with like this big facial hair, coarse facial features and pigmented skin. And when you ask them, initially they wouldn't tell you the history what they were doing, but when you really try and like extract it out, then you would know कि ये तो pharmacy से cream लेकर आए थे which had like steroidal base, and the steroid like calm कर दिया उसने skin को एकदम instantaneously, and then they continued using it every now and then, and now they have what we call is steroid dependence on the face, which is like very very tough to use, which is like a dermatologist's nightmare to treat. Like there's no good medication, no good treatment for it. So always, if you have acne, I'll take this medium. It's not like you have to visit me, visit anyone, visit a good dermatologist and have your product customized for yourself. Like know what you're using, read the packaging, ask your doctor. You have to really understand everything.
Right. So please don't abuse your skin. You know, if you have a condition, please go and consult the right person. A qualified dermatologist is what you need. कई बार यही होता है, हम होम रेमेडीज में, ओवर द काउंटर ट्रीटमेंट में, या दोस्तों ने या फैमिली मेंबर्स ने क्या किया था वो सब करके इतना वक्त जाया कर देते हैं, अपनी स्किन इतनी खराब कर लेते हैं. जब तक हम डर्मेटोलॉजिस्ट के पास पहुंचते हैं तब तक उनको भी लगता है कि अब तो ट्रीटमेंट बहुत लंबा चलेगा. तो हो सकता है अगर हम पहले ही चले जाते, एक तो विल सेव आवर एनर्जी, विल सेव आवर मनी, विल सेव आवर स्किन, विल सेव आवर हेल्थ. प्लीज वो सब सेव कीजिए, इधर उधर मत डाइवर्ट हो जाइए. प्लीज गो एंड कंसल्ट द राइट पर्सन, द क्वालिफाइड डर्मेटोलॉजिस्ट यू नीड. एक क्वेश्चन भी है, आप विटामिन सी की बात कर रहे थे, यहाँ पे एक क्वेश्चन भी है सौम्या शुक्ला का. व्हाट इज विटामिन सी एंड हाउ डज इट एड टू माय स्किन केयर रूटीन? तो अगेन, क्योंकि डॉक्टर विटामिन सी में जैसा आपने बोला कि विटामिन सी इज गुड फॉर योर हेल्थ, लेकिन नींबू अगर आप अपने चेहरे पे लगाएंगे इट विल इवेंचुअली बर्न योर स्किन. द सेम पीपल डू विद अदर स्टफ्स also. I mean, aloe vera या दूसरे जेल जो यूज किए जाते हैं डायरेक्टली टेकिंग फ्रॉम द प्लांट, हाउ सेफ कैन दैट बी? एंड प्लस द विटामिन सी पे तो आपका आंसर हम चाहेंगे.
सो विटामिन सी एक्चुअली एक एंटीऑक्सीडेंट है. सो विटामिन सी जो होता है वो फ्री रेडिकल डैमेज हमें एनवायरनमेंट से, पोल्यूशन की वजह से कॉन्स्टेंटली हमारी स्किन को इरिटेट कर रहा है. तो फ्री रेडिकल डैमेज का इफेक्ट को प्रिवेंशन के लिए विटामिन सी खाते हैं, लगाते हैं. इट इवन्स आउट skin tone, it promotes the collagen production. Collagen production is a very big thing. जैसे जैसे एज बढ़ती है वैसे वैसे कोलाजन का प्रोडक्शन कम होने लग जाता है. जनरली विटामिन सी का यूज हम लोग बेंजोइल पेरोक्साइड या जब एक्ने का एक्टिव ट्रीटमेंट चल रहा होता है तब विटामिन सी नहीं देते. एक बार एक्ने का ट्रीटमेंट थोड़ा कम हो जाए, हाइपर पिगमेंटेशन जब होती है तब हम विटामिन सी का यूज ज्यादा रखते हैं. बट अगेन लाइक आई सेड, एक्ने के ट्रीटमेंट में नंबर वन थिंग यू हैव टू अंडरस्टैंड इज पेशेंस. कोई भी प्रोडक्ट आप लगाते हो, बहुत सारे पेशेंट्स आते हैं 3-4 प्रिस्क्रिप्शन, 10-12 प्रिस्क्रिप्शन लेके कि हमने यहाँ दिखाया, दवाई काम नहीं कर रही. You look at the prescriptions closely and you realize that every medicine given was correct. Then why is it not working? Then you ask them कि आपने कैसे लगाया, वो लगाने का तरीका भी, they know how to do it, they're really doing it. Now when you tell them how long did you take it, so they'll say कि हमने 2 हफ्ता लगाया था, नहीं चला, नहीं हुआ. So then you have to tell them that 2-3 weeks is the minimum time you have to apply any product or take any medicine to see any change in your skin. At least what we tell our patients is कि 6 से 8, मैं तो 6 से 8 हफ्ता बोलती हूँ, because that gives them a little bit of time frame. 2-3 weeks is like the minimum time people can see a change. 6-8 is when there is like little improvement. जब आप 10-20% का improvement देख के appreciate करते हो. एक्ने का ट्रीटमेंट यूजुअली 3 से 6 महीने चलता है, और यही रीजन है 3 से 6 महीने चलाने का कि पहले एक्टिव एक्ने की स्टेज होती है, उसमें हम एंटीबायोटिक्स वगैरह देते हैं या हम लोग कोई हार्मोन की मेडिसिन देते हैं. वी ट्राई टू ब्रिंग डाउन द एक्टिव पार्ट. नाउ इट्स द फेडिंग पार्ट. नाउ वी हैव मोर ऑफ पिगमेंटेशन और द एक्ने स्कार्स. नाउ वी स्टार्ट देम ऑन लाइक सम काइंड ऑफ एजिक, कोजिक एसिड, अल्फा एल्बिट्रिक एसिड. इतने सारे एसिड आते हैं जिससे थोड़ी थोड़ी स्किन लाइटन हो जाती है, स्पॉट्स फेड आउट हो जाते हैं, स्किन इवन आउट हो जाती है. नाउ वी डू दैट, एजिलिक एसिड फॉर दैट मैटर. देन वी गिव दिस काइंड ऑफ अ ट्रीटमेंट. And then depending, every patient is different. So vitamin C also, yes, vitamin C, but vitamin C again like retinol cream वगैरह के साथ नहीं लगा सकते. विटामिन सी बहुत सारे सीरम्स के फॉर्म में आता है, बट नॉट एवरी सीरम ऑफ विटामिन सी इज गुड. विटामिन सी क्या है, स्टोर करने से डीऑक्सीडाइज हो जाता है, सो इट हैज टू बी केप्ट इन ग्लास बॉटल्स एंड डार्क कंटेनर्स. But a lot of times when you buy it from the store or you buy it from online, so a lot of time it's not the active vitamin C. Active vitamin C का जो serum होता है, that's very difficult to procure. It's very difficult to make, and there are very little good brands making it. ये रहता
Right.
है.
I'll also take few of the questions that viewers have asked. Sonia Singh पूछ रही है, does acne mean I'm not keeping my face clean enough? इसी से जुड़ा हुआ एक और सवाल मैं डॉक्टर पूछना चाहूंगी. कई बार जो acne prone skin होती है जिनकी, या फिर जिनकी oily skin होती है, they keep on washing their skin as soon as possible. उनको लगता है हम बार बार face wash से या cleanser से skin को wash करते रहेंगे तो हमारी skin ठीक रहेगी, oil secretion नहीं होगा, acne नहीं होगा. तो वो भी कितना ट्रू है, और इनका क्वेश्चन तो है.
बिल्कुल भी ट्रू नहीं है. एक्चुअली एक्ने इज नॉट अ हाइजीन प्रॉब्लम. एक्ने इज अ हार्मोनल इशू, मोर ऑफ अ सीबम प्रॉब्लम, मतलब मोर ऑफ ऑयली प्रॉब्लम. वो ऑयल ग्लैंड प्रोड्यूस कर रही है बिकॉज ऑफ हार्मोन्स एंड सेवरल अदर फैक्टर्स. और उसके अंदर कॉर्न्यूसाइट विच इज स्किन जो होती है वो छोटे छोटे कॉर्न्यूसाइट्स की बनी हुई होती है. तो उसमें कॉर्न्यूसाइट कोहेसिवनेस बोलते हैं हम, जिसमें कॉर्न्यूसाइट पास आने लग जाते हैं, सिबेशियस ग्लैंड्स बड़ी होने लग जाती है, एंड एज अ रिजल्ट पैप्यूल या पेस्ट्यूल या कॉमिडोन या कोई ना कोई एक्ने की स्टेज बन जाती है. सो डेफिनेटली नॉट. But also to emphasize, people over dry their face by washing. Sometimes what I see in patients is कि वो दो दो तीन तीन बार मुंह धो रहे हैं, और मुंह धोने से वो फेस और ओवर ड्राई हो जाता है. अगेन, अगर आप फेस को या स्किन को इन्फ्लेम कर रहे हो, इरिटेट कर रहे हो, then you will have more acne. Like I said, skipping a moisturizer is the worst you can do. Like people skip their moisturizer thinking कि हमें तो acne है, but you can't do that because your skin is getting dried up. You have to hydrate it. Maintaining a proper balance between like oiliness and dryness is the key. तो बार बार फेस को ना धोएं. फेस को एक बार या दो बार नियमित रूप से, अगर आप वर्कआउट कर रहे हैं, देन डेफिनेटली यू हैव टू वॉश योर फेस. देयर सेवरल थिंग्स यू हैव टू कीप इन माइंड. नंबर वन, अगर आप मेकअप लगाते हैं, मेकअप नीड्स टू कम ऑफ. नेवर एवर गो टू बेड विद योर मेकअप ऑन. मेकअप कैन रियली क्लॉग योर पोर्स. अगर आप मेकअप करके जिम जाएंगे तो भी इट विल मेक इट वर्स, क्योंकि स्वेट वगैरह की वजह से देन अगेन योर पोर्स विल बी क्लॉग्ड. स्क्रब्स वगैरह मत कीजिए. यू डोंट नीड स्क्रब्स. इफ यू वुड नीड, अ डॉक्टर विल सजेस्ट यू अ केमिकल peeling of salicylic acid, some 20%, 10%, depending on how your skin looks like, what it looks like. If you're not interested in chemical peeling, there are 10,000 other ways of treating it. Just like, don't get anything online. Just look at everything you're using, and it's definitely not a hygiene issue. आप बस फेस को एक बार धो लीजिए, दैट्स अबाउट इट. अगर आपको रीअप्लाई, कुछ आपको स्वेट करना है या कुछ ऐसा है दिन में, अगर आप ज़्यादा ऑयली हैं तो आप ब्लॉटिंग पेपर रखिए, उसमें डैब डैब कीजिए, रगड़िए मत, अपनी फेस को इरिटेट मत कीजिए. कीप योर हैंड्स ऑफ योर फेस. कई बार लोग आते हैं, वो खुजली होने लग जाती है उनके पिंपल्स में, या वो पिंपल्स को फोड़ लेते हैं. आप ये ध्यान रखिएगा, आप पिंपल्स फोड़ेंगे अगर आप फेस को ज़्यादा टच करेंगे, यू आर डैमेजिंग इट मोर देन द बेनिफिट. वो उसके निशान परमानेंट रह जाएंगे, एंड फिर बहुत डिफिकल्ट हो जाता है एक्ने स्कार्स का ट्रीटमेंट.
Exactly. So we need to be very gentle with our skin, or कुछ भी problem है तो please go and consult the right person. A qualified dermatologist is what you need. प्रकाश मेहरा पूछ रहे हैं, can acne treatments make acne worse?
A very interesting question. So usually acne treatments, whenever I give retinols, especially retinols जो एक्टिव्स होते हैं, जब मैं ये स्किन में देती हूँ तो मैं हमेशा उनको बोलती हूँ दैट यू माइट, सम पीपल माइट सी एन इंक्रीज इन द नंबर ऑफ पिंपल्स. बट आप अपने पेशेंट को रीअश्योर कर सकते हो, पहले से उनको बता सकते हो कि आप अगले 2-3 दिन में या अगले 1 वीक में यू माइट सी मोर ब्रेकआउट, बट डोंट वरी, दैट्स हाउ द मेडिसिन वर्क्स. इवेंचुअली ऑल विल फॉल इन प्लेस. इवेंचुअली ये सब कम हो जाएंगे. तो मैं उनको वर्स नहीं बोलूंगी, बट दैट्स हाउ द मेडिसिन वर्क्स. लाइक कई बार ब्रेकआउट्स मेडिसिन स्टार्ट करने के बाद होना नॉर्मल है, बट दैट जनरली सबसाइड्स इन अ वीक. जनरली 7 दिन से ऊपर नहीं रहता वो. एंड देन इवेंचुअली, लाइक आई सेड, you have to keep doing what you're doing in order to see some improvement. 2 से 3 हफ्ता मिनिमम है, 6 से 8 हफ्ता एटलीस्ट, like which makes almost like 1 से 1.5 महीना आपको चाहिए to see some substantial improvement, where people will also notice it. लोग भी आपको बोलने लग जाएंगे कि what are you doing to your skin is looking beautiful. आई थिंक पेशेंट या किसी भी इंसान के सबसे बड़ा कॉम्प्लीमेंट तब होता है जब उसको आसपास के लोग कहने लग जाए कि वाह आपकी स्किन तो बहुत अच्छी लग रही है, या व्हाट आर यू डूइंग, या वेयर आर यू गोइंग, या व्हाट हैव यू बीन यूजिंग योर स्किन. दैट्स व्हेन द पेशेंट इज द हैप्पीएस्ट. लाइक like they come to me and they say
Right.
हम जहाँ जाते हैं लोग पूछ रहे हैं क्या कर रहे हो इतना ग्लो आ रहा है क्या कर रहे हो एक्ने चले गए things like that. So जब तक आप 6 से 8 हफ्ते नहीं इस्तेमाल करोगे 1.5 महीना नहीं इस्तेमाल करोगे कोई प्रोडक्ट आपको नहीं पता चलेगा वो इम्प्रूवमेंट नहीं आ पाएगा और अगर आप सिर्फ डॉक्टर चेंज करते रहोगे प्रिस्क्रिप्शन चेंज करते रहोगे 2 हफ्ता ये मेडिसिन ले ली 4 हफ्ता वो मेडिसिन ले ली देन कुछ नहीं हो सकता आपका क्योंकि फिर आप सिर्फ you're in the middle of nowhere you've tried everything and nothing will work.
Right. And Doctor, as we are moving towards the conclusion part of this session, anything that we missed out on or anything that you would like to tell to our viewers in the end?
देखिए सबसे पहली चीज़ तो मैं ये बोलूँगी कि एक्ने जब आते हैं तभी आप उनका ट्रीटमेंट शुरू कर दीजिए द लॉन्गर यू वेट द वर्स इट गेट्स जितना इनिशियल स्टेजेस में आप ट्रीटमेंट ले लोगे उतना बेटर है बिकॉज मोस्ट ऑफ द पीपल माइट नॉट बी कंसर्न अबाउट एक्ने बट देन यू रियलाइज दैट एक्ने स्कार्स आर फॉर लाइफ अनलेस ट्रीटेड फिर एक्ने स्कार्स को ट्रीट करना भी बहुत टफ हो जाता है तो एक्ने को ट्रीट करें बहुत ज़रूरी है कि एक्ने को ट्रीट करें पार्लर्स वगैरह पे मत जाइए उनका ट्रीटमेंट मत लीजिए इट्स यूजलेस लिटरली डोंट बाय प्रोडक्ट्स फ्रॉम Nykaa.com or any kind of .com it's useless because they don't want to tell you the truth why will they tell you the truth so you have to go to and don't go to a chemist either a chemist is not a registered doctor I can't emphasize this enough I am seeing such bad cases people are going to untrained people for their diseases and when it gets really worse then they come to you with and then there's so much to treat अगर आपकी बॉडी पे भी एक्ने है तो बेंजोइल पेरोक्साइड की बहुत सारी बॉडी वॉश आती है क्लिंडामाइसिन वगैरह जेल्स में आता है क्रीम्स में आता है लोशंस में आता है अलग अलग किस्म में आता है वो सब आप ट्राई कीजिए फॉर ट्रंकल एक्ने फॉर चेस्ट एक्ने एंड फॉर बैक एक्ने some people also get acne at the back of their neck that's not acne but it's in the acne family also it's perfectly treatable some get acne on their scalp again it's in the acne family not acne but again treatable ये सब चीज़ें treatable हैं तो आप जाइए एक डर्माटोलॉजिस्ट की सलाह लीजिए कई बार एक्ने आपको एक्ने लगता है बट वो होता कुछ और है तो इट्स वेरी इंपॉर्टेंट टू समटाइम्स जस्ट रूल इट आउट समटाइम्स एक्ने कैन ऑल्सो हैपन इन न्यूनेट पैदा हुए बच्चों के अंदर भी छोटे छोटे से दाने होते हैं फेस के ऊपर उनका कोई कॉज नहीं होता वो अपने आप सबसाइड हो जाते हैं तो उन एक्ने को लेके परेशान ना होएं that's about it और acne का खाने से linked like I said this will be the last question so acne the only food that can cause acne is actually dairy and dairy products and food with high glycemic index and that like I said it's again controversial but just make sure every BB cream CC cream sunscreen foundation everything that goes on your face is non-comedogenic can't emphasize this enough it has to be non-comedogenic and then an exfoliating face wash with salicylic acid glycolic acid azelaic acid is required that will thin out the acne उसकी thickness कम हो जाएगी उसके अंदर जो acne में जो bacterial infiltration हो रहा है वो थोड़ा कम हो जाएगा skin थोड़ी सी peel हो जाएगी तो it will really help the whole pathophysiology of acne.
It was wonderful talking to you, Dr. Asma, and thank you so very much for your valuable time. It has been a very informative session, and I'm sure in the coming times we'll do many more such sessions with you for our viewers. Thank you so very much once again.
Awesome. Thank you so much for giving me this platform. Loved it. Thank you.
Thank you. And viewers, thank you for your active participation in today's session. Have a great day ahead. Goodbye.